Hello and welcome. I'm Greg Lake, co-founder and CEO of Fourth Power Labs. We are excited to bring you today's seminar, Revitalize Your Business as Patient Demand for CBD Increases. This seminar supports Fourth Power Labs' commitment to helping medical professionals serve their patients better. Typically, in a live audience setting, I would ask a couple questions regarding this topic. Number one is who is currently selling CBD products in their pharmacy? And the next follow-up question would be who has seen sales decrease over the last year or would like to increase CBD sales? In a live event, you typically see many hands raise. Over the past 4 months, I've had the privilege to be in hundreds of independent pharmacies across the country. And what I've learned are two main points. One, independent pharmacies are extremely busy, either due to the current staffing shortages, the vaccine administration, and just general business workings. I've also seen that consumers have changed the way that they purchase CBD, and we've seen CBD sales decline within independent pharmacies, primarily because many patients are now buying CBD products online, and independent pharmacies are being disintermediated with the brands that they carry. However, the one thing that remains true is independent pharmacies still understand the profit potential for CBD and have a passion and would like to bring the sales back. A lot has changed since 2019 and pre-COVID. However, what I've learned also is that while we're faced with new learnings on how to do business in the new normal, the how has changed. However, the why stays the same. The opportunity to grow a successful front-end CBD business and serve your patients is strong, but how you do it has changed. Today's success is based around knowledge of the benefits, how it works, selecting products of the highest quality, and building awareness with your patients. Today, I'm joined by a panel of accomplished professionals that will guide us through the next hour. With us today is Dr. Rakna Patel. Dr. Patel has, if we could go back one slide, I'm sorry about that, please. We expect to cover a lot today. While we will do our best to get through the content within the hour and reserve time for question and answers, we may not have time for all the questions that you have. During the presentation, I would ask if you have questions to please input those into the chat box. We will facilitate those. If we do not have time to reach those questions by the end of the presentation, we will get back with you one-on-one. Next slide. Today, I have the pleasure of introducing our speaker, world-recognized cannabis medicine expert, Dr. Rakna Patel. Dr. Patel is the Chief Medical Advisor for Fourth Power Labs. She completed her undergraduate studies at Northwestern University in Illinois and earned her medical degree from Touro University in California. She is also licensed in the state of California. After spending time training as an emergency medicine doctor and working with patients to help alleviate pain, Dr. Patel ventured into the field of cannabinoid medicine in 2012. In 2014, she started her own practice so that she could offer people care they otherwise didn't have access to. Her consultations have helped thousands of patients relieve their symptoms, transform their health, and live a better quality of life with cannabinoid products. Now on a mission to impact lives beyond her lifetime, she's published a book in partnership with Penguin Random House, has grown a YouTube channel to over 1 million views, has been interviewed on over 300 podcasts, serves as a go-to media correspondent, has taken the stage internationally, educating both medical and non-medical audiences, and most importantly, dedicates her time to educating other medical professionals about cannabinoids. Please help me welcome Dr. Patel.
Thank you, Greg, for that lovely introduction. So if we could go back to slide number 3 really quick. Perfect. Okay, so my objective in today's presentation is to answer some of the commonly asked questions that I get from pharmacists. And typically these are questions that, in turn that they get from the patients that they're serving. So overall, I'm going to go over give you a clinical perspective of cannabinoids. What I have found in my practice, cannabinoids to be most effective for. Now, the other thing is that I'm going to go over the importance of lab testing. I'll walk you through why it's important to know what is in the product. Okay, so if we could go back to, perfect. And you can go ahead to the next slide. All right, so first and foremost, I'm going to walk you through the research on pain when it comes to cannabinoids. So let me walk you through a couple different studies. So first study was published in 2003, and it looked at the effects of whole plant extracts of delta-9 THC, which is colloquially known as just THC, CBD, and a 1-to-1 ratio of CBD to THC. And specifically, they looked at the effects of these extracts on neurogenic symptoms due to multiple sclerosis, spinal cord injury, brachial plexus injury, and limb amputations. Overall, fairly painful conditions. And these patients were unresponsive to standard treatment. Now, in comparison to placebo, CBD significantly improved pain, and CBD also appeared to have an antispasmodic effect. Now, in another study, which was published in 2020, in this particular study, they audited a patient population referred to a primary care clinic in New Zealand specifically for CBD oil. And results showed that patients experiencing non-cancer pain symptoms had a significant improvement of self-reported mobility, ability to complete their usual activities, pain and anxiety and/or depression. Patients with mental health-related symptoms also experienced improvements in their ability to carry out their usual activities, pain and anxiety and/or depression. And then finally, patients with cancer symptoms experienced improvements in pain. Overall, of those prescribed CBD, 44% reported good treatment benefit for relatively intractable conditions. And that's important because intractable conditions are the conditions for which patients really struggle. They can't really seem to find a solution with conventional medications. And more often than not, what I found in my clinical practice is that they do, in fact, find a solution with cannabinoids. All right, so if we can move on to the next slide. All right, so the next area that I want to focus on is anxiety. Okay, so I'm going to walk you through a research study that specifically focuses on social anxiety disorder, but the results can really extend to any category of anxiety. So this particular study was published in 2011, and it compared the effects of a simulated public speaking test on healthy control patients and treatment-naive social anxiety disorder patients who received a single dose of CBD or placebo. Now, participants received CBD or placebo an hour and a half before the test, and the healthy control performed the test without receiving any medication. So overall, pre-treatment with CBD significantly reduced anxiety, cognitive impairment, and discomfort in speech performance, as well as significantly reduced their alert in anticipatory speech. The placebo, on the other hand, placebo group, on the other hand, reported higher anxiety, cognitive impairment, discomfort, and alert levels when compared to the control group. So overall, these preliminary results indicate that a single dose of CBD can reduce the anxiety-enhancing effect provoked by public speaking, in this particular case, in social anxiety disorder patients. Okay, if we can go to the next slide, perfect. Okay, now I'm going to talk about difficulties sleeping, starting with some research. So a study published in 2019 did a retrospective study on the clinical application of CBD for anxiety and sleep complaints as an adjunct to usual treatment. If you could go to the next slide. Overall, sleep scores improved by 66.7% in the first month, and then 2 months after the start of treatment, 56.1% of patients reported improvement in sleep. Okay, if we could go to the next slide. All right, so imagine that you get a lot of questions from patients about side effects, specifically of cannabidiol, CBD. Next slide. So overall, when it comes to the side effects of cannabidiol, research shows that the most commonly reported side effects include tiredness, diarrhea, and decreased appetite and weight. Now, I do want to comment that clinically what I've seen is that, yes, patients, when they take what's known as, as pharmacists, as a toxic dose that's not within their therapeutic range, they do experience tiredness. Oftentimes they'll complain that they wake up feeling groggy or hungover, but very easily reversible with dose adjustment. Diarrhea, I've had a handful of patients experience in the thousands of patients that I've treated, in which case I've just told the patients to discontinue treatment. And then decreased appetite and weight loss, though it is documented in the research, it's not something that I've had patients report back to me in clinical practice. So that is important to make note of. Okay, next slide. Now, it's also important to go over the side effects that CBD does not cause. And there have been medical studies that have pointed to the side effects that CBD does not cause. So CBD does not cause catalepsy. CBD does not alter heart rate, blood pressure, and body temperature. CBD does not adversely affect psychological and psychomotor functions. CBD does not affect the transit of food through the gastrointestinal tract. And then finally, CBD does not cause psychoactive effects, unlike its counterpart, THC. Next slide, please. Okay, so given that I've gone through a list of side effects, it's important to know how to manage the side effects. So I'm going to give you some just a broad overview here. If we could go to the next slide, please. Okay, so overall, when it comes to managing the side effects of cannabinoids, there's a very basic principle at play. The side effects of cannabinoids are self-limited and take up to several hours to resolve. That's it, period. Of course, do advise patients to call 911 in the instance of tachycardia, chest pain, tightness, shortness of breath, emesis, syncope, and or suicidal or homicidal ideation. Next slide. Okay, so I imagine this is another common question that you get from your patients, and it's in regards to cannabinoids and drug interactions. So I want to go over both what the research says, as well as what the clinical data shows is happening. So let's review both. All right, so CBD is an inhibitor of cytochrome P3A4 and cytochrome P2D6. And both cytochrome P3A4 and cytochrome P2D6, they both metabolize many different drugs. And so theoretically, CBD could increase serum concentrations of a number of classes of drugs that I've listed in front of you. Okay, so this is theory. Now, what happens in reality? Let's go to the next slide. Okay, so I'm going to walk you through the clinical data that we've come across so far. So first and foremost, warfarin. Research shows that THC and CBD do in fact increase warfarin levels. So it is important that those who utilize CBD, that their INR levels get checked frequently. When it comes to clobazam, research has shown that children treated with CBD, specifically for epilepsy, CBD increased clobazam levels, and so the clobazam levels had to be adjusted accordingly. And then finally, with valproic acid, some patients taking Epidiolex, which is the prescription version of CBD, taking Epidiolex concomitantly with valproic acid developed elevated aminotransferase concentrations. However, in all such cases, liver enzyme levels either resolved spontaneously after Epidiolex dose was reduced or stopped, or the dose of another anti-seizure medication was reduced. So that is important to keep in mind. Then the other important thing to note is that there are clinical trials that have shown cannabinoids to have no effect on some prescription medications. And so I've presented in front of you some examples. What I want to point out is the research behind CNS depressants. So in a small study, cannabis did not have additive CNS effects when combined with opioids. And that's important to keep in mind. In fact, clinically, what I found is that those who combine the use of cannabinoids, including CBD, with opioids, more often than not, either discontinue the use of opioids altogether, or they're able to reduce the dosage of the opioid that they're taking, or the number of opioids that they're taking as well. So that is an important factor to keep in mind.
Great.
Okay.
Oh, go ahead, Dr. Pell.
Oh, go ahead, Greg.
No, please. Were you setting up the slide?
Yes, I was.
Okay, go ahead.
Okay, and then the other important factor to know is that what's the quality of the CBD products that you're recommending to patients. Okay, this is incredibly important given that the industry is unregulated. Now, I as a physician have to use the utmost care and the utmost caution in recommending products, especially having been in the industry for as long as I have and knowing sort of the shortcuts that go on behind the scenes. So I'm going to give you a couple of pointers. First and foremost, and we can go on to the next slide. So first and foremost, you want to make sure that you always take a look at the laboratory test results for the products that you're recommending to your patients. And you want to look for a couple different things when you're looking at these laboratory test results. First and foremost, what is the potency of the cannabinoids, right? Now, specifically, what is the potency of CBD and what is the potency of THC? With THC, you absolutely need to make sure that the potency is less than 0.3% because that is what's required by law. By law, any product that's derived from hemp has to have less than 0.3% THC. Otherwise, by default, it's considered a marijuana-derived product, okay? And then when it comes to CBD, it's important to note the strength of the product, okay? And also, how much does the potency differ from what's indicated on the laboratory test result versus what's on the label, okay? That is important too. Oftentimes, you'll see products that differ by a factor of 20%, plus or minus 20%. And what that affects are the results that patients experience. When from product to product, from batch to batch that they purchase. So it's absolutely important to ensure that patients are getting consistent results. And the way to get consistent results is to have a consistent product. Next thing is that you want to ensure that the product has been tested for microbial contaminants. Namely because, for instance, bacteria such as E. coli and Salmonella have been traced back to the cannabis sativa L plant species. And also, there have been fungal components like aspergillus that have been found in the plant species as well, putting especially immunocompromised patients at risk. Then you want to ensure that the product has been tested for pesticides. More often than not, there are banned pesticides and oftentimes, toxic levels of pesticides showing up in the end product. And you don't want that ending up harming your patient. The other factor is heavy metals. Specifically, you want these products tested for heavy metals such as arsenic, cadmium, lead, and mercury. The hemp plant is a bioaccumulator. In other words, it just soaks up the heavy metals in its environment. And so it's especially important to ensure that the end product doesn't have toxic levels of these heavy metals. And then finally, when residual solvents, when solvents are utilized, it's first and foremost important that there's safe and non-toxic solvents that are utilized. And should hydrocarbons, for instance, be utilized, then it's important that when it comes to the residuals, that the levels are non-toxic. So, from a medical perspective, as a physician who's been in the field since 2012, these are the factors that I consider very, very important when it comes to recommending CBD products to patients. And we can move on to the next slide.
All right, great. Thank you, Dr. Patel. Very, very informative. And I think everyone begins to see that, revitalizing CBD sales is really a three-pronged approach. One is having the education and understanding, not only at the pharmacy level amongst the staff at the pharmacy that's serving the patient, but then also helping to educate the patients themselves around the benefits of CBD. And Dr. Patel, you today have done a great job of giving us some information. There's also some other webinars that are under Fourth Power Labs and YouTube that do a little bit deeper dive into some of these topics as well that I encourage you to look at. The other two components are really around quality of product. So having a quality of product to sell, and then having some really robust marketing processes and systems in place to help drive awareness and help generate sales are two other key pieces. To continue the dialogue around revitalizing CBD sales in your pharmacy, our next guest is Dr. Dave Miller. I had the pleasure of meeting Dave, well over 5 years ago. Dave is a customer of Letco Medical. Letco Medical is a organization that serves compounding pharmacies for all of their active pharmaceutical ingredients, as well as supplies and equipment. Dave and I work hand in hand with Letco, but also during our years together with Letco and his pharmacy, we've had the chance to talk about CBD. And Dave is a thought leader when it comes to CBD, and a person that's dedicated to quality, not only in his compounding business, but also as it relates to CBD. One of the big questions that he brought to light to me years back, nearly 4 years back, was the statement on bottles as it relates to milligrams, right? And then comparing it to C of A. So as an example, the C of A may claim that the product has 200 milligrams in the bottle, but on the packaging it says 300 milligrams. And so the things that we were trying to grasp and get our arms around was, how do you deal with product that's super potent and or under potency, and the variability by lot and the ability to serve patient? It's just very foreign to pharmacists and medical professionals dealing in a world like that. However, with nearly 3,000 brands in the marketplace today, not all CBD is created equal. So I'm excited to have Dr. Dave with us today to go through some of those. Let me just give you a little bit about Dave's background. Dave earned a baccalaureate in pharmacy from Ferris State, a doctorate in pharmaceutics from the University of Michigan with emphasis on transdermal drug delivery systems. In 2003, Dave joined his partners at Keystone Pharmacy, a traditional and compounding pharmacy serving the state of Michigan. He served as member of the Alliance for Compounding Board of Directors for 7 years, and he currently serves as the president-elect of the board. He's a fellow of the Alliance for Pharmacy Compounding and is currently vice president on the board of directors. Dave is also a fellow of the American College of Apothecaries and is also an associate professor for pharmaceutics at Ferris State University. Please help me welcome Dr. Dave Miller.
Thank you, Greg. Everyone on this call is a drug expert. You all are in pharmacies, you understand pharmacology. I know that quality is very important to you. So as we go through this next section, I want you to remember that you're a drug expert, and cannabinoids are drugs. So who's better to serve the patient in addressing these questions, addressing concerns they have? You or the person across the road at the gas station who's selling cannabidiol because their bosses told them to. When I started looking into cannabidiol and cannabinoid products, I was shocked at what I found. I approach everything that I do from a compounding pharmacy perspective. And anytime I get an ingredient in that I use in my compounding operation, the very first thing I do before the bottle's open, before the bottle's put into production, before anything's done with that, is I look at a certificate of analysis. And the certificates of analysis tell you from an independent laboratory's perspective what's in that product. Dr. Patel mentioned there's things that we want to make sure that it contains. We want to make sure the product contains what it should contain and what it doesn't contain what it shouldn't contain. I found different qualities in my compounding operation, but not enough to cause me to hit a hard stop on a particular brand and say we're not going to carry that brand because they're largely FDA regulated. Cannabidiol and cannabinoid products, however, are not regulated in any form. So the only regulation we have is our own regulation. Let's take a look at some of the things that I found in my journey to carry forth Power Labs. Next slide, please. Oh, first, let's go through some terminology. Patients will come to you with a bottle of CBD and say, how does your product compare to this product? There's CBD isolate. That only contains cannabidiol. It shouldn't contain THC, and it probably doesn't contain terpenes. Then there's broad spectrum products. They mainly contain cannabidiol. They might have some minor cannabinoids and plant terpenes, but they contain no detectable amounts of THC. And then there's full spectrum products. They have cannabidiol, they have minor cannabinoids, they have the terpenes, and they have detectable amounts of THC. But again, as Dr. Patel said, remember the Agriculture Improvement Act, also known as the Hemp Bill of 2018, made it illegal to have products that contains less or more than 0.3% THC on a dried basis. So it's important that you know when a patient brings in their bottle, what you're comparing it to. And some bottles are just labeled hemp oil. If you look at a bottle that says 300 milligrams and the patient paid $20 for this 300 milligram bottle of whatever it is, it's probably just hemp oil because only 50% of the hemp oil are active cannabinoids. So when somebody comes into you with a really cheap bottle and they're saying, well, how does yours compare and why is it so expensive? I don't like to use the term expensive because it's a great value, but you need to be educated on what's in that bottle in order to talk to your patients and make sure that they're educated. Next slide, please. So this is one that I found. This is a 30 ml bottle, and it was labeled as containing 300 milligrams of cannabinoids, and it's a broad spectrum. What's really, really concerning, look right at the top line. This contains 1.48% THC. If you're a pharmacy and you're carrying a product that has 1.48% THC, it's essentially marijuana. And if the DEA came in, they would shut you down. So it's important to note that this product would get you shut down. It probably would cost you your business. And it would certainly cause your patients to get the psychoactive effects of the THC. And that's what we're trying to avoid with CBD-rich products. So this product would be an absolute no-go. And if you look at the amount of cannabidiol in it, CBD, it's 0.03%. So it doesn't contain, well, it might contain 300 milligrams of cannabinoids, but it doesn't contain the right type of cannabinoids. Next slide, please. Here's one. This is a 30 milliliter bottle. It's labeled as a broad spectrum product, but when you look at it, the only thing in it is CBD. So it's technically a CBD isolate product. And this slide's a little bit hard to see, but it contains 1.1 milligram per milliliter of cannabidiol. Remember, the company stated that it's a 60 milligram bottle in 30 mils. Now, I'm not a math major, but I can multiply 30 times 1.1 and I get 33 milligrams. So this product is half as potent as the labeling on the bottle. Next slide, please. When we look at this product has the right amount of cannabinoids, but they didn't test it for pesticides. They didn't test it for microbes, and they didn't test it for foreign matters such as heavy metal. Pesticides are really important, and it's important that you search out products that source their hemp from American agriculture. A lot of the cheap hemp products that we have are coming from China, and Dr. Patel mentioned that they can contain heavy metals. Hemp is a biosponge. It's an environmental sponge, a bioaccumulator, and they plant hemp products specifically in polluted areas to draw up the toxins from the soil, such as heavy metals, cadmium, lead, arsenic, and mercury. When you take a hemp plant and you harvest it, you have to dry it pretty quickly. And if you don't, of course, yeast and mold grow on moist surfaces. So if you don't test your product for yeast and mold, you don't have any idea if they have yeast and mold. So it's really important that you study the certificate of analysis to make sure that they don't contain microbes. And pesticides are very important. One of the unique things that's happening in our country is we're converting tobacco infrastructure, because people aren't smoking as much, into cannabinoid infrastructure. So the drying barns and things that they use to dry tobacco are the same drying barns now that they used to dry cannabinoids. And the good thing is, in states where they grow tobacco, they have very, very strict pesticide rules. But again, if you don't test for it, you don't know if it's there or not. Next slide, please. And this is a product that we carried for a while, and this product contained plus or minus 15% of the targeted labeled amount of cannabinoids. It was usually on the high end. And it wasn't just plus 15%. I saw it as high as plus 40% one time. Remember, cannabinoids are drugs, right? And so if we have a patient on a product that contains the labeled amount one time, 140% of the labeled amount the next time, 105% the next time, we don't get consistent clinical outcomes with that product because the variance is just too great. That's why I love Fourth Power Labs. Next slide. I've not seen a certificate of analysis on a product as tight as Fourth Power Labs. Their claims on the label are within 2.5% of the results on the certificate of analysis. That's what they strive for. And lately it's been less than 1%. Remember, the standard for drug products, the FDA standard for drug products is plus or minus 5%. And here we have a company that's figured out a way to label their products appropriately and extract the product so that it's plus or minus 1%. The quality is outstanding. They also don't have any detectable levels of THC. So for patients that might have concerns about THC, there's a question in the chat box about using cannabidiol products in children. If you do that, I'll let Dr. Patel address the question at the end, but if you use it in children, you have to make sure it doesn't contain THC, because THC delays the development of the prefrontal cortex until you're about 25 years old, until the prefrontal cortex is fully developed. And that inhibits social consciousness, social development. It inhibits a lot of things. So you can't have THC in your products. Fourth Power Labs tests their products for 13 mycotoxins, 20 residual solvents, 500 pesticides, and their certificates of analysis, they're a little daunting to read because they tend to be 26 pages, but it's very important that whatever cannabinoid product that you get in your store, you look at the certificate analysis from beginning to end to make sure that it's the best quality product for your patient. Next slide, please. Last month, this is true, in October, I filled 230 prescriptions for which I was reimbursed $5,453 less than it cost me to buy the prescription. And I know if you're a pharmacy owner or a pharmacist watching this, you know exactly what I'm talking about. And that doesn't include DIR fees. That was just on the front end, point of sale, lost that money on 230 prescriptions. So if there's a way that I can help my patients and help my profits, I'm going to do that. Next slide, please. Because we all know that we're not getting rich off the PBMs. The only people getting rich off the PBMs are the PBMs. They're squeezing us tighter and tighter and tighter, and it's costing us, it's going to cost us our livelihoods unless we can figure out a way to develop alternative revenue streams. Next slide, please. You make 87 cents on a Xanax prescription, right? You know why your patients are getting Xanax and why they're getting Ambien and why they're getting Norco. Dr. Raphael Mechoulam, he's the father, really the godfather from Israel of the endocannabinoid system, was once quoted saying, somebody asked him, can you name all the systems that the endocannabinoid system influences? And he said, I cannot name all the systems in the body that the endocannabinoid system influences because there's simply too many. The endocannabinoid system's involved in everything, and healthy support of the endocannabinoid system with natural products can help people with their anxiety. The studies show anxiety, sleep, and pain. So you know why your patients are getting Xanax, Ambien, and Norco. You also know that you're making very, very little on those. If you believe that a hemp product, a naturally derived hemp product, can help patients with those conditions, I would concede that you're not doing them a favor by not recommending it to them. And you'd have to fill 36 prescriptions of Xanax, 3 years worth for most patients, to equal 1 bottle of the 20 milligram sublingual oil. And the sublingual oil is going to help your patients probably equally in an equal amount as the Xanax prescriptions. Next slide, please. I love this display. Fourth Power Labs did a really great job with this display. I have it on my counter. It takes up like about 1.5 feet of counter space. And if you turn that display, you make about $800. Just sell everything on it, you make about $800. If you can turn that display 12 times a year, you can turn a profit of $9,600 a year on 1.5 feet of countertop space. It's outstanding. It's incredible. I don't have any other space in my pharmacy that generates that kind of revenue and that kind of profit. And that's just assuming 1 turn a month. There's pharmacies out there that are doing $20,000 to $30,000 a month, and there's one pharmacy I know of that's doing $80,000 in cannabidiol sales a month. That's $1 million a year with 50% profits. Who wants $1 million a year with 50% profits? Can you make that selling Xanax, Ambien, or Norco? You can't do it. The margins just aren't there. Well, you can't do it legally, I guess. Maybe some people are, but no, the margins just aren't there. So this countertop display is fantastic. I love what it's doing. We put it in a very prominent display or very prominent space right by the cashiers. We've educated our cashiers on what the product is. Next slide, please. And so that becomes important. How do you move cannabidiol products? You have to cultivate a champion. And I got to tell you, it's probably not going to be the pharmacist. The pharmacist is just too busy. You have to find somebody that loves the product, that's willing to use it, and that is willing to recommend it to help patients. Somebody who really loves people. In my store, that's my wife. She's a people lover. That's why I love her. So you have to cultivate a CBD champion. You have to make sure that they're educated on the product. And Fourth Power Labs has some great educational material. As I mentioned at the beginning, you are the drug expert. You are the drug expert. So you become educated. Can you imagine Mrs. Jones when she says, well, should I buy this bottle of CBD? And you say, I don't know, Mrs. Jones. Let me do a drug interaction check for you to make sure that you're not on any drugs which will interact with this product. She's going to be blown away. She won't get that from the video store. She won't get that from her chiropractor. She won't get that from the gas station attendant who are all selling CBD. She'll be blown away. So you become the drug expert in CBD because it is truly a drug. Again, educate your staff and your patients about CBD and how it can help them with pain, anxiety, sleep, etc. We're not making claims. They haven't been FDA approved, but the studies are clear that cannabidiol helps with those products, and you can let them know about the studies and maybe even give them a bag stuffer. So there's bag stuffers that we have for every patient who gets a pain medication. Ask us about cannabidiol. For every patient that gets an anxiolytic, ask us about cannabidiol. For every patient that gets a sleeping medicine, ask us about cannabidiol. And they go in every bag. We go through about 5,000 of those a month. You may need to offer more than one CBD brand to ensure your flexibility. Fourth Power Labs is a great product. It's a young product. So there's other brands out there that have things like cooling lotion for a diabetic foot, for example. So look at different products and different offerings. I would say Fourth Power Labs offers you a very good core for what you're trying to do with your products. And as I mentioned, use the bag stuffers, social media graphics, and everything that Fourth Power Labs is making available to you to help promote this material. Next slide, please. And this is where I'm going to turn it over to Greg.
Yeah, awesome, Dave. I appreciate the input and the information. And Dave probably does himself a very small amount of justice when he speaks about the success he has in his pharmacy. But he's very dedicated to CBD and has had an extreme amount of success. And I've relied on him over the years to get educated. And he was one of the main drivers early on in helping me understand how pharmacists think about CBD and how they interact with their patients. Fourth Power Labs, as I mentioned earlier, is really a product of our parent company, Letco Medical. Myself and my three partners, as well as the team at Fourth Power Labs, has well over 25 years of experience servicing independent pharmacies and medical professionals. So we're dedicated. We understand your businesses. Brands that you may be familiar with that we've managed in the past: Amerisource Bergen, Major Laboratories, Rugby Laboratories, Harvard Drug Group, just to name a few, as well as Letco Medical. So again, for over 25 years, we've been in your business and we understand it. And so when I started to see the pain from profits or lack of profits that was beginning to become a trend within independent pharmacies, saw the overwhelming demand by patients for CBD, as well as reviewing many of the stories of how CBD has affected patients' lives. It only made sense for us to venture into creating a CBD brand that could be utilized specifically by independent pharmacies and their patients. And why that's important, Dave mentioned, is there's over 3,000 brands that are out there today. And understanding the quality and having a brand that you can protect your reputation as well as serve patients and participate in the profitability was extremely important. However, there was a big chasm between the ability to find those products right and then bring those to market. So we identified an ability and a need to go out and create a product based around three legs of the stool. One is education, okay, which Dr. Patel really helped to enlighten us about the endocannabinoid systems, drug interactions, and also the clinical place for CBD with your patients. The quality, Dave helped us understand, how do you really discern who has products and what to look for. And then Dave also talked a little bit on the marketing. So when we put Fourth Power Labs together, it was really based around those three things. The other thing that really got under my skin and was really exacerbated by the advent of COVID was CBD sales were doing very well for a period of time in independent pharmacies, and I think there was a couple reasons. One is there was a big patient demand and curiosity, right? It was new product, and there was a lot of awareness and periodicals around it. So they would come into the pharmacy and ask about it. Independent pharmacies started to carry the product and started to achieve very high levels of sales. Then COVID happened and the amount of foot traffic declined, and patients were able to take the brand that they had, go online and type in that brand, and then quickly identify that they could purchase that brand online. And the pain point for independent pharmacies was the patient was then ordering direct from the company, and the pharmacy was losing that relationship, revenues, and profits. Fourth Power Labs saw that as a pain point, and as we began to create the brand, we created a closed loop system that enables you to keep a strong relationship with your patient and protect the profits. And what I mean by that is patients cannot buy Fourth Power Labs in a retail store other than an independent pharmacy or medical practice. And most importantly, they can't buy online unless they have a medical provider code. So all Fourth Power Lab customers or pharmacies have a provider code that's specific to that pharmacy. They then distribute that to patients. And when patients go on fourthpowerlabs.com, they have the ability to create an account utilizing that provider code, which then allows them to purchase. The benefit is to the patient, they can shop from their home if they're unable to make it into the pharmacy. The benefit to the pharmacy is they're able to then capture that relationship, get reports on who's buying online, but more importantly, retain the profit of that purchase. And we can discuss that more with you if you like. But again, Fourth Power Labs was really created with independent pharmacies and medical professionals in mind to really bring a quality product as an adjunct therapy to patients, but then also allow practices to grow and participate in the revenues and profits. With that said, Dave, you mentioned one thing that was very interesting to me about the alternative brand. And when I'm in these pharmacies, a lot of times I'll talk to pharmacists or I'll talk to doctors, and they'll say, well, I'm already covered. I have a brand already in place. And they think that that's enough to carry today and to solve all the needs of the patients or all the curiosities patients have. However, if I look down the line or aisle in a pharmacy, I'll often look at the pain reliever aisle, and I'll see 5 or 6 or 7 different brands, and I'll often ask, well, why don't you just carry Tylenol? And quickly they'll say, well, that doesn't solve the needs of all my patients. And I'm beginning to see where CBD has that ability. And also what I've heard, and I would love to hear your thoughts, is that when you bring in a different or an alternative brand to work in harmony with the CBD brand you already carry, that also invigorates your staff to have to learn more about CBD. So it almost revitalizes the sales team to want to be able to learn more, and then that then gets projected onto patients, which then increases awareness and increases sales. So I know you mentioned that, Dave, and I just wanted to get your thoughts again on how that alternative brand strategies worked for you.
Boy, Greg, yeah, you bring up a lot of really good points. So the first thing that happens with our patients, a lot of them don't like the taste of the cannabinoid products that we carry. They just taste, they call it earthy, but it's really skunky. Anybody that's smelled these products knows that they have kind of a skunky odor and a skunky taste. And so competing products have tried to flavor them, vanilla orange flavor or just natural flavor. Fourth Power Labs did a lot of testing for flavor profiles, and I was involved in those initial tests, and it was very in depth. And so they've done a lot of work, and their product is preferred, what, Greg, about 10-1? I think the stats are about 10-1 over competing products just based on taste alone. And then,
Yeah, I think you're referring, Dave. We did a study when we began to formulate this. So all of our formulations have been done by pharmacists, as well as a group out of California that does formulation work. And so to ensure that we had the right formula, we went out and did an independent study with a firm out of Manhattan, and we took a very large sample size of patients across the United States and had them rate our products on many different levels. And the one point that you bring up that we thought was interesting and we didn't really consider was that 9 out of 10 people preferred the taste of our tincture over all of the leading independent pharmacy brands that we tested against. And when we looked at that, we didn't really realize that there were so many people out there that just didn't like the taste of the tinctures, and were relieved to find that. And the other thing that then the follow-up question of that was, would you refer this based on the taste? Would you refer it to a friend? And again, 9 out of 10 would refer it to a friend. And why that's important is if you have a patient, they like something, they refer it to their family member or friend, then that creates an additional sale. And then also with that medical provider code, we've actually had people talk about giving that medical provider code out to people that don't even live in the states, and pharmacies getting sales from patients that are out of state that are just related to people that are giving these referrals. So that's an interesting observation and point that you bring up, Dave.
yeah, and a couple other things. The other professional brand product that we sell in pharmacies has a 15 milligram soft gel. Fourth Power Labs has a 15 and a 25 milligram soft gel. I heard from my wife, who's our CBD champion, yesterday. She said the patient didn't get any relief from the 15 milligram soft gel, but 25 milligrams was the right dose for them, and they ended up with relief from whatever they were suffering from. Another thing I like about Fourth Power Labs is an adjunct. The competing professional brand that we carry, the roll-on for pain, is 500 milligrams of active cannabinoids. Fourth Power Labs is 750 milligrams. So the amount of cannabinoids in that product, it just works better for me. I know a lot of you are stressed out all day and you go home and your neck hurts because of so much stress. I got to tell you that 750 milligram roll-on just does the work for me. And then another thing that really sells me on the product is it's rich in a cannabinoid called cannabigerol, CBG. And CBG research is just starting to enter its full stride, if you will. And we know that CBG helps with inflammation and other systems, other things that impact the endocannabinoid system. And so we're waiting to see where this goes. But if a patient could get something that helps both with pain and inflammation because it's CBG rich, to me, that's a big selling point. Again, we're not making claims because it hasn't been evaluated by the Food and Drug Administration. This is just what the clinical studies so far have shown.
Right, right. All right. Well, thanks again, Dave. A lot of great comments and observations. At this point, I would love to turn over the direction to questions. And I know we have one question, Dr. Patel, that you may have read already that's in the comment section. Have you had a chance to read that by chance?
I have had a chance to read the question, and I actually like to read it out loud because I think it's a really important question to ask. So this question is asking, I'm writing my questions now. Well, let me skip over to the actual question. Lots of questions for children use and dosing, especially in this epidemic of anxiety and depression. Some providers wanting to try CBD instead of a prescribed antidepressant or anti-anxiety medication. I've seen very little research in children. Okay, and I just educate parents so that they can make an informed decision for their children. I've recommended the creams for possible relief of anxiety, for pain or insomnia. Okay, so a couple different things that I want to go over here. When it comes to what the research says in terms of safety for use in children, I'm going to refer back to the study that's been done on Epidiolex. That basically said that CBD is safe to use in anyone over the age of 2. Okay. And I myself have treated young children, in my case, as young as 5, with cannabinoids without having any reports from parents or caregivers of side effects or any adverse drug to drug interactions. Where you do want to be cautious is in patients who are utilizing any medication, prescribed medication that has a potential to cause hepatocellular injury. That's when you run into the realm of potentially impacting liver enzyme levels, which then have to be monitored closely. Now, when it comes to utilizing topicals for anxiety and insomnia, typically not effective. For conditions like anxiety and insomnia, what I found to be most effective are internal use products, right? So we're talking about sublinguals, for instance, as well as oral medications. So that's a much better route to go, even in children, for the use of anxiety and insomnia.
Okay, great, Dr. Patel. And just as a clarification too, on fourth power labeling that may be relevant for our question, is we have labeled our products to say for adult use only, not for use by children, teenagers, or women who are pregnant or breastfeeding, and to consult medical professionals before using this product. So that's our labeling on our Fourth Power Lab products, just for clarity as well. Great question. What other questions might we have? And I know that if you can't submit those in chat, you can feel free to submit those to marketing@fourthpowerlabs.com. As we wait for those, Jason, you two have been out in a couple hundred pharmacies in the last few months, right? As we work the Fourth Power brand. What would you say is one of the biggest questions you have around revitalizing business and observations that you might give a quick recommendation to consider for folks?
Yeah, sure. Greg, I was thinking about this through the presentation, and like you said, going out into, hundreds of pharmacies and kind of seeing what they're doing with CBD. And like we were, like Dr. Patel and Dr. Dave mentioned, and what we believe at Fourth Power Labs is it's very important for CBD to be guided and recommended by a medical professional. And we've kind of taken on this mission of educating medical professionals, in particular pharmacies and pharmacists, to become comfortable in, discussing CBD with their patients and then understanding the business opportunity. And those are the things that I get the most questions about when I'm going out into pharmacies is the comfort level of the pharmacist and their staff and how they promote it, how they talk to patients about it. And that's what we're doing here and what we're achieving with this webinar and the other webinars we've done. And it will continue to be our mission to educate pharmacists and their staff on and becoming comfortable and talking about CBD and the benefits it does have with their patients, and then also the financial, benefit as well.
Yeah, great point, Jason. And Jason leads all of our business development and sales and support for the organization. And I think it's really important to talk about our customer success specialist position and the team we have there and the resource and the ideas. And we have a couple minutes left, so we might have to be a little bit brief, but I'm really proud of our team and the differentiation that Fourth Power Labs brings and the value with that. Could you talk real quick about our team and kind of how they're focused?
Yeah, sorry, I meant to mention that the mission that we have in education, both on the CBD, the endocannabinoid side, as well as the the financial benefit to the pharmacy. We use marketing and webinars to do that, but we also use our customer success team. And we have a second to none onboarding process in which we touch base, make sure you understand what you're receiving from us in a welcome kit and products and marketing material, and then also to support you. And I think Dr. Dave mentioned a couple of those things that he's received from us and our customer success team when it comes to bag stuffers with your provider code, social media posts. So it's just continuous touch points, anything we might be seeing in the industry and anything we learn while we're doing these webinars and gaining, and doing presentations at NCPA, while Greg and I and other people in the company are out and about in pharmacies and getting kind of real world learnings, we will continuously share those through this means of webinar, and then also through our customer success team as well.
Yeah, perfect, Jason. The one thing I would add to that, or kind of emphasize, is that whether you're watching live or you're watching on a replay, at any time you have a specific need or an idea, right, to make us stronger, to help serve you, please contact us at the information that's on the screen today, and we will work with you individually. I think that's what Jason alluded to. Is we take an individual approach, so no request is too small or big. We will spend the time with you and your team to help you be successful. Again, that's our biggest mission, is your success. With that, Claire, have we had any questions come in?
There have not been any that have come through the email.
Okay, great. Again, if there's questions that come to light later, please contact us. We'll be happy to answer those one-on-one. But as conclusion for today, I'd like to thank Dr. Dave, Dr. Patel, Jason, as well as the entire Fourth Power Lab team that helped put this together. This is part of a series of webinars hosted by Fourth Power Labs. We look forward to partnering with you on your journey to make better happen. Of course, if you'd like to be notified of upcoming webinars and other Fourth Power Labs educational events, you can subscribe to our newsletter at our website, fourthpowerlabs.com. You can also email us directly at marketing@fourthpowerlabs.com. And I highly encourage you to follow us at Facebook, LinkedIn, and Instagram. We have many posts by our marketing team that can keep you connected and keep you educated. With that said, I thank you for your time today and look forward to the next time that we're able to get together. Thanks.